Good evening everyone. Today we are going to see about the conduction of cardiopulmonary bypass. So what is cardiopulmonary bypass? We have seen in the previous session that it is a technique where a heart-lung machine takes over the functions of the heart and the lungs, and the blood from the heart is diverted into an extracorporeal system, the ECC system. So this provides a bloodless field for the surgeon to operate, and also the extracorporeal circulation does the circulatory, and the extracorporeal circulation does the circulatory and respiratory support for the patient. Also managing the temperature throughout the surgery, either cooling the patient and rewarming back the patient. Now what are the steps that we see or what we have to see in the cardiopulmonary bypass conduction? First of all, there is a pre-bypass checklist. So what are the things, what are the disposables, what are the hardwares that are going to be used for that particular patient? We have to have a detailed account of the patient data, and then selection of the CPB circuit is very important, because each patient will have a different circuit and a different size of tubings and different disposables. And then these circuits have to be joined to one another. That is, the meaning is assembling the complete circuit with the means of tubings and connections and other purge lines. After assembling, this circuit has to be filled with a solution, a balanced electrolyte solution, which is called the prime. So we have to prime the entire circuit so that this forms a connection between the patient and the heart-lung machine. After priming and checking the full circuit for any leaks or any cracks, etc., the conduction of bypass can be divided into three parts. That is the initiation, how the bypass procedure starts very slowly and gently, and how we conduct a smooth bypass run, taking into consideration the metabolic and the physiological aspects of the blood. And of course, after the surgery is over, how we come off bypass, that is how we disconnect the connection between the patient and the heart-lung machine. So now we would be going into the details. Now before any patient is wheeled into the theatre, as the perfusionists who are in charge of the heart-lung machine, they have a detailed plan of checklist. First of all, the patient parameters have to be taken into consideration. The complete diagnosis, the parameters, the height, weight, etc., the lab investigations, all these are charted out in their checklists. Then the components that are used for this cardiopulmonary bypass, the disposable components, products, expiry dates, their capacities, their configurations, all these have to be sorted out prior to the patient coming in. You have to check the parameter of the patient and select the appropriate disposables for the patient. And coming to the heart-lung machine, so which is the main component. So this heart-lung machine has to be checked thoroughly if all the power connections are in place, if the switches are okay, if there's no problem in the startup systems, and also if there's a backup system. In case this heart-lung machine fails for some reason, there should be always be a second machine elsewhere near the theatre. And the other gadgets along with the heart-lung machine, say the heater cooler machine or the hemotherm, which is used to either cool the patient during the surgery and also rewarm the patient back to its normal temperature. If these systems are okay, the switches have to be on and put off and checked once or twice. And the gas supply is very important. If the central supply, the pressures are okay, and the central system pressures, and of course and also the gas supply system, which is very important. You have to check the manifold systems if the pressures in the system are okay, and also if your vaporizers are all set in and working. And also important, you should have a oxygen cylinder in case there for some reason there is some problem from the central supply. You should have a backup oxygen system, and you have to have a cylinder checked and kept next to the pump inside the theatre. Pump, of course, you have to check the direction of the pumps. You have to check the flow meters if the revolutions are okay and the revolutions correspond with the flow rates. These parameters are also checked, and the direction of the pump. It should not be in the opposite direction, which may be hazardous or it can be fatal also. And once the assembling is done and the tubes are inserted inside the pumps, we have to check the integrity of the tubings, and if there are any leaks or cracks or any of such things in the pump heads. And then monitoring systems have to be seen. Say if the temperature probes are okay, and if the timers are okay, and all those switches have to be checked. And alarms and safety systems. So most of the pumps, or almost all pumps, they should have an alarm system incorporated, like the low level alarm systems and bubble detectors. All these are incorporated in the heart-lung machines. So they should be checked if they are on the on mode. And coming to the disposables, the oxygenator, which does the function of the lung. So check the oxygenator, check all the ports, check the gas vents, so that the scavenger system is intact, and also for any leaks in the three ways and connections. So all this have to be thoroughly checked before going on pump.